Hi, everyone. Welcome to another episode of Health Matters with Laura Kopek, and I'm your host. And today we're going to talk about thyroid and thyroid autoimmune and what it means to start thinking about how to consider and test for some underlying issues that might be causing your thyroid to go a little bit wonky, right? Most thyroid imbalances actually have an autoimmune. Hashimoto's is the name of thyroid autoimmune, and a lot of times that is coexisting. So, a lot of practitioners do not test antibodies. We test antibodies here. We want to know your baseline because also the cool thing about monitoring your thyroid antibodies is that we know if you're making progress in the areas that we tested for, that we only really want to test once for, because to get that data is really expensive. I'm going to show you one of the handouts we have on the practice website under the resource tab. We call it the autoimmune handout. And I'm going to help you see. It's right here. Again, we call it the autoimmune handout. We are really big on education. And what we want to do is use this as a checklist, if you will, and go through it and go, what is existing here that contributes? The thyroid is this soft, beautiful butterfly-like gland. And really, the easiest way to understand it is thyroid is gut, and also thyroid is part of your hormonal system in the way that hormones are linked to it as well. So at the top of this handout, again, if we were to use this as a check sheet to look at what is influencing your thyroid, we're going to look at the gut health, right? Overgrowth in yeast. And really, if you suffer from chronic stress, even if you're not doing any refined sugars, then you might find that you still have yeast overgrowth in your gut. Our gut is made up of viruses, bacteria, and fungi. We want an ecosystem that is in balance. We don't want a sterile gut. So we want that balance. We don't want an overgrowth in these things. If there is overgrowth in the viral quantity, then we can experience things like long COVID and chronic Lyme and high levels of Epstein-Barr. Real straight up infection might be H. pylori. The elusive, more troublesome one is the SIBO or SIBO. It stands for small intestinal bacterial overgrowth. So again, it's an overgrowth. So we're looking at the rest of the digestive system to see where it's coming from. Histamines, I do believe that most often there is a histamine issue going on. This sometimes can be like the hidden culprit. To tease it out is much more complicated. Hormonal imbalances, estrogen dominance. Actually, estrogen dominance is going to be very tied to gut health. So again, we're back up to the gut. Low progesterone is more tied to a chronic stress response. It's going to be tied to age as well, but what we want to pay attention to is the reason why there could be a hormonal balance, because you basically functional medicine, it stands for root cause. It's also an area of health that we look at that's different than diagnostic, but also I want everyone to start to think about it as like the deep dive. We need to deep dive in diagnostic as well as this area here, functional. Our hormones are very systemic. It's why a lot of people are like, it's too hard to figure it out. It just requires some level of comprehensive understanding and diligence. And I'll do one of these on hormones, but for the sake of understanding, again, thyroid, and then again, my approach would be root cause of root cause. So estrogen dominance is going to contribute to a thyroid, a gut health, which is going to contribute to a thyroid imbalance. But what's causing that? What's causing the low progesterone? Is it just age? Or is it also going to be like chronic stress, right? If there's adrenal fatigue, this and any stress can alter the way your autonomic nervous system is responding, which is then going to alter your digestive system. And sometimes the stress is just, it's not really the way we think about stress. Do I constantly talk about stress is narrow-mindedly misunderstood, but even an athlete that trains or a dancer, high level of training, that's just a constant stress on the body. And they may be an expert and they're really healthy and fit, but what is that doing? Entrepreneurs like myself, business owners, or high level business executives, they might be under tremendous adrenal fatigue, and then that can impact the gut and it can impact the thyroid. So knowing all these pieces you may not be able to control. I'm always going to be a business owner. It's some things in your life are just not going to change, but are you looking at and supporting those systems? Are you understanding how that connects to your thyroid so that you can manage your thyroid? It's not just about managing a few of the lab numbers. Your doctor is always going to check your TSH. If you're on thyroid medication, you may or may not get T3 or T4 checked as well. They just want the numbers to dose the medication. They're not looking at the deep dive in your diagnostic to look at antibodies, because in diagnostic, it doesn't affect your medication. So in diagnostic medicine, what's the need to test? In a functional approach, a deep dive approach to diagnostic is going to be looking at your antibodies on an ongoing basis. It's a measurement of inflammation, if nothing else. If you decide you're not going to go into this deep dive into thyroid, at least know what level of inflammation you have in your thyroid. So we're big on, again, having all the information so you know what is contributing to it as you go. Blood sugar imbalances, again, gut, right? We cannot not consider this a part of the underlying contributing factors. Trauma, I am talking more and more about this as an impact on the immune system. It can very much impact thyroid. And this goes back to, even Louise Hayes wrote a book and talked about what's an underlying like psychic imprint onto the imbalance. If you haven't read Dr. John Sarno, The Mind Body Divide, Heal Your Back Pain, he talks about the connection. And of course, the body keeps a score, but there's a ton of growing conversation around this. Biofilm, this is a slime cellular matrix. I'm always talking about this as a real hidden villain. It really is a separate thing, but it's part of the gut. It can exist in the nasal folds, in the GI tract, in the urinary tract and bladder. So it's something to be considered and talked about. Nutritional deficiencies, we think if we're out in the sun, we don't need to take vitamin D. If you've got gut issues or estrogen dominance, it may be contributing to an iron or ferritin deficiency. Nutritional issues like food sensitivities, cow dairy might be huge for keeping your thyroid inflamed. Gluten, that's a pretty well known, talked about, but like maybe even testing for celiac markers. And of course, the one that's not really talked about enough is mouth. And this is in smaller circles, but it's something that really needs to be talked about, getting into a more suited toothpaste and mouthwash for your condition to support your thyroid. Okay, how do we get to some of these things? How do we get to the data that says that we have some of these issues going on? How do we tease this out? Our favorite panel here is called the Nutri-Eval, and this is something that we're really big on. It is the big blood work urine panel that will show a lot of things that aren't really evident in a diagnostic blood work. So this kind of functional assessment will give you so much data about what is really going on in your thyroid. Okay. So looking at oxidative stress, looking at mitochondrial, which is like cellular inflammation, omegas, toxicity like heavy metals, that's definitely can be contributing to thyroid, and methylation. So, having a broader idea of what all your nutritional deficiencies, right? We talked about nutritional deficiencies. If your TSH can be normalized, but your T3 and T4 can't, That's something to really think about in terms of nutrient deficiencies and what's going on in your GI tract. Because basically, you want enough of your TSH, thyroid stimulating hormone, to combine correctly with some of your minerals, iodine, selenium, iron. That's why you hear things like, oh, take selenium, take this to support your thyroid. But we actually should be getting enough of that from food and storing it correctly. So we need to look at if we're, first of all, are we deficient in those things? And if we are, what is the contributing cause? If you go to this one here, I have a lot of people that come in and they've been just taking selenium. They don't even know if they need it. And right here, you can see this test for selenium in whole blood. A lot of times, maybe this is too high, and that can be contributing. So, really knowing, do you need something? Is it too high now? Are you taking the wrong dose? Is it enough to take it in your multivitamin? We test iodine in diagnostic testing, but my favorite page in this to look at what's happening is that in your gut is this one. Look at how cool this is here. So you've got these acids that we can measure. And basically, when people use that word inflammation, what is inflammation? How can we measure it? Basically, you could call this the inflammatory test because these acids are all, if out of homeostasis, are going to contribute to an inflammatory state. So knowing these and then having it pieced together so it can connect some dots. So like here, indoletic acid, if this is elevated, someone may not be making enough pancreatic enzymes. Phenylatic acid, there could be inflammation in the small intestine. There could be a lack of stomach acid production. Again, we want to link this to stress. Looking at the stress test is another that companion of these two functional panels give you the most amount of information. And the question might be like, why? If my medication corrects my TSH, why do I care to do all this? Statistically, more than half of people that have thyroid condition still experience symptoms. And then it may spiral into other things that then you might want to pay attention to. Is this any of this contributing to elevated cholesterol, where you might want to think about not, can I avoid a statin? Is any of this starting to contribute to high blood pressure? And maybe you don't want to be on blood pressure medication, or maybe you can't, there's something called blood pressure that's resistant. There's a lot of conditions that are becoming resistant to some of the medication, and people are adding more than one medication. And do you want to be able to be healthy even on your medication because your medication may not be controlling it enough and now you're adding more and more medication and it just starting you down this slope. So there's always knowledge and power and knowledge, whether you want to do something about the things. It's basically how much control, how much support do you want to create for yourself as you're kind of building the information. But for a lot of people, the thyroid starts to become a slippery slope, and looking at the contributing underneath problems to it is can make you feel like you're taking charge of your health, can make you feel like you're really on top of things. A lot of these are linked to other things, and having someone who doesn't just interpret this at face value, we really do strategically connect the dots on this report. So you're not just getting the data, you're actually getting a strategy with it. What kind of digestive enzyme do you need? We're looking at all the different factors to determine the potency on it so that it's the right fit for you. We're teasing out things like, is there inflammation in and the risk of a small intestinal bacterial overgrowth with 3-hydroxyphenylitic acid elevated? Is there yeast overgrowth? And where is that coming from? And what is the burden on the liver and kidneys? And as you go through this report and we gather that data, mitochondrial inflammation is like so important to know. And it's something that you really don't find in other tests. What is your cellular inflammation? And how is that impacting your hormones, your stress response, your thyroid? It really is an important thing to know. So here's just an example of a couple of things that we really like to educate and gather data on so that you have a better sense of what is going on with your thyroid and how we can begin to manage and support it effectively. I really appreciate you joining me. I hope this was really a valuable information. Please come back for another episode of Health Matters with Laura.